Nowadays, healthcare is rapidly evolving with increasing digitalization, and this requires healthcare professionals to adopt and develop digital health competence.
And for this presentation, we will summarize a qualitative study exploring how healthcare professionals perceive their digital health competence. In other terms, how they assess their own skill in using digital health technologies.
We will also discuss key findings and implications for improving healthcare practices.
This study is crucial to ensure healthcare professionals feel capable with digital tools for better treatment of patients.
This study is entitled Healthcare Professionals' Perception of Digital Health Competence, a qualitative descriptive study.
And the authors of this study followed the following researchers and was written year 2022.
Now, let's look at the objectives of this presentation. Number 1, to describe healthcare professionals' perception of their digital health competence.
And now, let's dive into the core of the study by looking at the abstract. This study aimed to know what healthcare professionals think about their own skill in using digital tools for healthcare. And the key finding in this study was the healthcare workers see that being good with digital health is being able to take care of patients well. Using technology effectively and mixing those new methods with the old, traditional ways of doing things to newer and more advanced ways.
As a medical technology student, we are constantly learning about new tools and technology that are changing healthcare. But technology alone isn't enough. We need to understand how healthcare professionals, the people who actually use them together with their job. This study shows us what's hard and what's good about using technology in healthcare. It tells us what we need to train people well, give them support, and always focus on what's the best for the patients.
The population is the healthcare professionals in Sweden and Finland.
And the samples are the nurses and allied health professionals from Sweden that has a sample size of 5 people, and from Finland who have a sample size of 15 people. Now let's talk about variables. It's helpful to think about what factors might influence healthcare professional perception about their digital health competence. In this research, we can consider the independent variable aspects as the characteristic or experiences that might affect their perception. For example, things like healthcare professionals' age, their specific job, whether they are a nurse, therapist, or others. We can also consider how long they have been working and if they have previous training with digital health technologies.
The dependent variable is the perception of their own digital health competence. In this research, this is what we're trying to understand and how competent they feel about their skill in using digital tools for their job. And here are the nominals: specific healthcare profession, gender, and workplace, while the ordinal is the self-rated digital competence level. And the ratios are age and duration of professional experience. And lastly, the interval is instead of rating scales, the researchers use semi-structured interview-type questionnaire to collect data.
The researchers use a semi-structured interview, and their sampling methods are purposive and convenient sampling. They also use a SRQR.
Parameter of this study are the healthcare professionals from Sweden and Finland, while the statistics in this study are the nurses and allied health professionals from Sweden that has a sample size of 5 people and from Finland who have a sample size of 15 people.
Now, let's discuss the core findings of this study, which provided valuable insight into the research questions. And this is where the researchers examine the interview to identify the main ideas and recurring topics.
First, let's talk about the descriptive results. Let's take a look at the table that presents demographic and professional information about a group of healthcare professionals from Finland and Sweden. The average age of all participants was 40.4 years, ranging from 27 to 57. The average age was slightly higher in Finland, which is 40.8 years, ranged to 27 to 57, compared to Sweden, which is 39.2 years, ranged to 33 to 48. And the majority of the participants were female and made up of 85%. Half of the participants were registered nurses, which is 50%, followed by physiotherapists, which is 30%, and other health professionals. And lastly, the average work experience was 12.8 years, ranging from 1 to 33 years. The average work experience was slightly higher in Finland, that has 13.6 years, ranged to 1 to 33, compared to Sweden, who have 10.4 years, ranged to 3 to 17.
And with the use of content analysis, the main conclusion is that healthcare professionals see digital health competence as equal in providing the best possible care to patients using digital tools, meaning giving their best in using digital health technology. This includes being able to use technology effectively, knowing when to use digital methods versus traditional methods while putting patient care first. In addition, the study also showed that some healthcare professionals feel confident about their digital skills while others feel like they need more training and support. And because of this result, it highlights the need for ongoing education and resources to help everyone feel comfortable using technology in their work. And to finish this presentation, as an aspiring healthcare professional, the conclusion of the study is particularly significant as it highlights that digital health competence is not just a nice-to-have skill, but it has become a requirement to provide a higher quality and patient-centered care. For us medtech students, the main point is that we should use digital tools but always think about what's best for the patient. It's not about getting rid of the old ways, but about mixing them with the new to make things better.